Hello, this is Dr. Peter Diamore again with the Orthopedic Center of South Florida. I'm an orthopedic spine surgeon here today to talk to you about a common condition seen in many of our patients coming into clinic called lumbar spinal stenosis. Lumbar spinal stenosis refers to a narrowing in the spinal canal in the lumbar portion of the spine. The lumbar portion of the spine is in the lower part of the back. It helps us with bending and twisting. Stenosis comes from the Greek word which means to make narrow. This narrowing can put pressure on the nerves traveling from your spinal cord to the muscles in your thighs and legs. Spinal stenosis can happen in any part of your spine, but it's most commonly seen in the lumbar portion of the spine, otherwise found in the lower back. This narrowing and resulting tightness in the spinal canal puts pressure on the nerves, which can cause patients difficulty with walking long distances. Patients suffering from spinal stenosis may experience symptoms gradually over time that include back pain, burning or cramping going into the buttocks or into the thighs and legs, numbness, tingling, weakness, and leg pain. In very advanced cases, patients may even experience difficulty controlling their bowels and bladder. Sometimes, patients develop severe pain or weakness into one or both legs. Often, patients with spinal stenosis report that they feel much better leaning forward. This change in position is usually related to pushing a shopping cart in a grocery store. Patients usually say that leaning forward on a shopping cart improves their symptoms and allows them to walk much further. Many physicians refer to this as a shopping cart sign. This leaning forward helps to widen the spinal canal to take the pressure off the nerves, which in turn helps decrease the symptoms felt in the legs, buttocks, and thighs. The most common cause of spinal stenosis is osteoarthritis of the spine. Arthritis is generally related to wear and tear of the spine that happens to the joints and discs over time. This gradual wear and tear can lead to thickening of the ligaments within the spinal canal and bone spurs to form, which all contribute to spinal canal narrowing and pressure on the nerves. Arthritis can be seen on X-rays, MRIs, and CT scans on most people's spines to a varying degree by around the age of 50. This is why most patients with spinal stenosis that becomes symptomatic usually begin to experience symptoms around the age of 50, give or take. Spinal stenosis is diagnosed by carefully listening to your symptoms and performing a physical examination. Additionally, X-rays and MRI images of the lower back are performed to give a detailed look at the bones and nerves within the spine and the spinal canal. MRI studies of the lumbar spine or lower back help us determine where the narrowing is occurring in the lumbar spine. The narrowing of the spinal canal causes crowding of the nerve roots, which can lead to difficulty walking longer distances and possibly weakness, pain, numbness, or cramping, as we discussed. I often explain the appearance on MRI as pieces of spaghetti being crowded together in a pot of boiling water. Normally, the nerves can each be seen individually with surrounding spinal fluid, like pieces of spaghetti suspended in a pot of water. When someone has spinal stenosis, this narrowing causes us to lose the ability to see the spinal fluid around each of these nerves. Sometimes, if it's very severe, we can't even see the individual nerve roots or pieces of spaghetti because they're clumped together. Unfortunately, there's no cure for spinal stenosis, but there are several treatments that can be used to help minimize symptoms and ultimately treat spinal stenosis. Often, we first start with conservative measures to treat the stenosis and its associated symptoms. This includes physical therapy to help strengthen the core muscles and the muscles of the back. We often try anti-inflammatory medications to help relieve pain and associated inflammation. Sometimes an epidural steroid injection will be performed to help reduce the inflammation and provide symptomatic relief for the leg symptoms patients experience. This can often provide patients with several weeks up to a few months of relief and can be repeated on several occasions a year if necessary. If conservative treatments like physical therapy, anti-inflammatories, and epidural injections become ineffective, or if patients start to develop associated weakness or bowel and bladder issues, surgery is often discussed with the patient to relieve the pressure off of these nerves. The surgery most commonly performed is called a laminectomy. This procedure removes a portion of the bones in the back of the spine to widen the spinal canal. During the procedure, we meticulously removed thickened ligament and bone spurs that are putting excess pressure onto the nerves. By removing this narrowing or stenosis, we remove the pressure off the nerves. In turn, this helps improve or eliminate the symptoms of stenosis, most commonly walking intolerances, cramping, burning, and pain in the thighs and the legs. Sometimes, in addition to removing the arthritis by performing a laminectomy, we also perform a fusion procedure to help stabilize the spine to maintain the widening of the spinal canal, in turn taking pressure off the nerves. The best ways to prevent spinal stenosis from becoming a problem is to stay active by exercising your core muscles and keeping your back healthy. Examples of such exercises like swimming, walking, and weight training help to keep the muscles that support the lower back strong and healthy. Patients should try to maintain a good posture and perform safe lifting practices when picking up objects. Patients should avoid smoking and try to maintain a healthy weight, which will help prevent degeneration of the discs within the spine and will help take the stress off the back that can all contribute to spinal stenosis and the symptoms of spinal stenosis. If you or someone you know has been diagnosed with spinal stenosis or is suffering from some of the symptoms of spinal stenosis we discussed, I'm happy to see you at any of our 3 locations conveniently for a consultation to discuss your specific issues. I see patients at the Plantation, Pembroke Pines, and Miami Lakes locations. To make an appointment, please visit us at www.ocsfdocs.com or call us at 954-473-6344. Thank you for tuning in today and have a wonderful day.